I'm Dr. Rothenberg. My first name's Stephanie. I'm one of the doctors at Pacific Northwest Fertility. So I'm a fertility doctor, and I'm here with Michael as well. I'll let him introduce himself.
Hi, I'm Michael Chally. I'm the executive director at Northwest Surrogacy Center and one of the co-owners. And we are a surrogacy agency located in Portland, Oregon, with offices also in Seattle and San Francisco. The goal today is to talk a little bit about how to get started with the surrogacy. And I'm really thankful that Dr. Rothenberger is here with us today. We work with lots of different IVF clinics, and Pacific Northwest Fertility is definitely one of our favorites.
And ditto, we love working with Northwest Surrogacy. I think that one of the biggest things we wanted to just review for you, first of all, is answer all of your questions and then just maybe explain a little bit of what this process might look like, because it can be overwhelming when you're first trying to learn about fertility treatment or surrogacy. There's a lot of moving pieces, and you probably have never done this before, but we do it a lot. So we're here to help guide you through the process.
Yeah, and one of the first things that people always ask about is timing. First, how do I find an IVF clinic and an agency? Do I need to have them at the same time? Should I do one first? And the answer is there's no right way to do it. There are more efficient ways to do it. And so you are going to need both an IVF clinic and a surrogacy agency as you go through this process. Typically, our families are going to be creating embryos as part of the process, and Dr. Rothenberger is the expert on that part, so I'll let her speak to that. But we see that process does take usually somewhere between 2 and 6 months, depending on whether or not you're using your own genetics or working with an egg donor. And it does take us a little while to find a surrogate for families, typically somewhere between 6 and 12 months from the time you sign up until you receive the profile of a surrogate. And so for most families, it makes sense to sign up at Northwest at about the same time they sign up with their IVF clinic or a little bit before.
And I think that one of the helpful things too is to just try to simplify the process, right? It's easy to get bogged down in all of these details. There's so many pieces that go into growing your family, particularly with IVF and surrogacy. But ultimately, the recipe is actually very simple: eggs, sperm, place to put them, right? And so my job is to really figure out, do we have all three of these ingredients? Do we not have them? And how do we get them? And so I think just coming in with, okay, this is actually just this process of getting these three things and then baby at the end of the day. So I think trying to simplify that in your mind and try not to be too intimidated. You don't have to know everything to come in, and we're here to guide you and talk you through the process. But basically the first piece is getting eggs out. The second piece is creating embryos. And then the third piece is putting one of those embryos into a uterus. And that whole process from start to finish, when we have all of those ingredients, takes about 3.5 to 4 months. Okay. We add a month or two on at the beginning to do initial testing and things like that. With the surrogacy piece, there adds a little piece in there of kind of making sure that we are able to have that uterus ready to go. And so it does add some time in there. And that's usually a common question is, what is the timeline and what to expect there?
Yeah, and the way the process starts is, at least at Northwest, is you don't need to have embryos to sign up with us. You do need to have embryos before we'll match you with the surrogate. And that's an important distinction, because what it allows you to do is move through the timeline and not have to wait as long once you do have your embryos to be matched with a surrogate, and everyone's ready to move forward at the same time or close to it. One of the things that we often see are questions about how you get started with this process. And the best way to get started with this process is really a conversation with both your IVF clinic and with your surrogacy agency. And we're both here to have those conversations. There's no fee to talk to us initially and to help guide you through what the process looks like with both organizations, what it looks like from a financial perspective, as well as the timeline and all the steps in those timelines.
And let me give a little example, because I think I might answer some of the questions that are starting to pop up. I would say that the most common way that people come into this process is do a consultation with a fertility doctor, right? And talk through what's your situation, what are the things that you might need in terms of treatment. And then when we're in the process of determining how do we get eggs out, how are we making embryos, You're meeting with surrogacy agencies during that time and deciding who you want to work with. So it's a partnership there. So we're multitasking. It's two parallel processes of working on getting embryos while we're working on finding the right uterus to take home a healthy baby. There's a couple questions about egg donors. So for the egg donor piece, in terms of timeline, it depends a little bit. At PNWF, we have 3 different ways of having an egg donor. The first is we have our own egg bank that's called Simplify. Those eggs have already gone through the process of getting out and they're in the freezer and ready to go. So that's a really fast process because we've done part number 1 already. Okay. And so typically selecting the donor takes the longest amount of time, but once you've selected a donor, we have embryos within about 6 to 8 weeks ready to go. The second option is that through PNWF, we have a pool of donors who are available to you where you would go through that donor, you would select the donor, and then that donor would go through the process. That's a good option, particularly if you want to have more than one child, because you get more embryos with that process. It does take a little bit longer because the donor is in the pool, but we have to coordinate with scheduling and things like that. And then the process of getting eggs out takes 2 to 3 weeks. So a little bit more lead time there. The third option is a good option if you're looking for something very specific with a donor that we may not have at PNWF. We typically have a pool of donors between 80 to 130 at any given time between our donors who are able to cycle and our egg bank together. But sometimes we don't have exactly what you're looking for. And so there's another kind of friend that we can loop in, which would be a donor egg agency. That can add more time to the process of finding which agency you want to work with and finding a donor there. So the timeline depends a little bit on how we're getting that first piece going. But that hopefully I answered that second question too, that the egg donor process is typically through the clinic that you're working with.
Yeah, and the one thing I would add is Northwest does have its own egg donor program. We actually have 2. One is called Asia West Egg Donors, and that's focused on Asian donors. About 20% of our families are Asian, and sometimes it's difficult to find Asian donors, and that's why we focused on that population. We also have Intend Egg Donors, and that's basically focused on all the other populations that we work with. And a lot of our egg donor process happens with Pacific Northwest. And sometimes we have a family that works with us for a surrogacy, sometimes with an egg donation, often for both. And that can make it a smooth process. And there's no requirement from either of our organizations that you don't have to use our egg donor program and our surrogacy program. You can use one or the other. And the same is true with Pacific Northwest.
No rules for this. We want you to have the family that you want to have, however you get there. The question about fresh versus frozen eggs, this is very fertility clinic specific. So you need to ask that question to every single fertility clinic that you talk to. Freezing eggs is a relatively new technology. It's only been non-experimental since 2012. And it's a really difficult cell to freeze and thaw. It's the biggest cell in the human body. That's a fun cocktail party fact in the front of the cocktail party. But for lack of a better way to describe it, they can get freezer burn if it's not done well. And so you definitely want to go somewhere or use an egg bank that does this a lot and has a lot of quality control. And that's one thing that I can very comfortably say. We've had our own egg bank since 2008. So when it was still experimental, and our success rates are very high. Looking at our data, the success rates with embryos made from frozen eggs is about 5% lower. So for our most hot off the press recent data for 2025 for PNWF for a fresh donor with a gestational carrier, it's about 80% ongoing pregnancy rate. We're very proud of that. That's much higher than what's typically quoted. For frozen, it's about 75%, so potentially a little bit lower, but still very successful.
Yeah, and that is a great number. There are 3 things that we look for in working with any IVF clinic. And the first one is success rates. And Pacific Northwest has some of the highest success rates of any clinic that we work with. The second thing that we look for is good communication. And in the surrogacy, there's so much extra communication that needs to happen. So it's not just the family, it's the surrogate, it's the surrogacy agency. And working with an IVF clinic who has that experience and those high success rates really does make a difference as you move through this process. And that actually takes me to one of the other questions that has been asked about, do you have to pay extra to the surrogate if there's more than one implementation that happens or one try? And so typically, as you go through a surrogacy, your contract with the surrogate says that you'll try up to 3 times unless the surrogate is medically disqualified or can't move forward for some other reason. And depending on which program you go with, some programs, like we have a guarantee program where it's a fixed cost. And so whether you're doing 1 transfer or you're doing 3 transfers, it's the same cost. We also have a variable cost program that can be less expensive for some people if they are successful in that first transfer. And in that case, you would pay a little bit extra in costs for each transfer. So the surrogate would typically have to travel to the clinic, and there might be hotel, there might be airplane, things like that. So there are some additional costs that you might encounter. There are also additional costs often on the medical side of things. So I'll let Dr. Rothenberg talk about that. But from our side of things, typically families don't pay much, if anything else, for a second transfer if they need one. It's one of the reasons, though, it's great to work with a clinic with a high success rate, because your chances of needing to come back for a second transfer are much less.
Yeah, I love that you guys have a set price option too. That does try to take off the pressure a little bit. Like even in the perfect conditions, fertility treatment is super hard and it's not 100%, and it definitely can be a journey, some longer than others. So it's nice to not have that piece to stress about. I love that. Yeah, go ahead.
So I was just going to say, one of the other questions we're seeing here is, do I need to go to the clinic and the agency in person during this process?
Yeah.
We both work with families from all over the world. And although the majority of at least our families are on the West Coast, it's not a requirement for our agency that we ever see you in person. It is, we do a lot of Zooms and we talk to a lot of people that way. We'd love it when people do come into the office, and we'd be happy to talk to you here, but it's not a requirement for our side of the program.
Yeah, and same for us. We do all of our consultations on Zoom. So I see people from around the world. That makes things easy. If you're using your own eggs, then there is some time that you would come here, typically about a week, depending where you live and what resources are available to you. For if we're using your sperm and you live somewhere else, then we would have you come here for one visit and freeze sperm. And then, of course, we would love for people to be able to come for an embryo transfer, which is like the most magical of days. It never gets old, but it's not mandatory. We definitely would want you to either be on the phone or preferably on a video call to do all of the confirmations and things like that. So that is required, but not in person. It's our preference, but not required.
So one of the other questions was about how long does it take to get matched? And then is there anything you can do to make it faster? So for us, it is 6 to 12 months right now. At Pacific Northwest, 10 months is our average. As far as making it faster, there are some things that you can do as far as preferences. So one of the things that we want to do as part of this process is match you with a surrogate who meets your preferences. And those preferences can be around things like communication, her location, things like that. The more open you are to different kinds of surrogates, the easier it is to match you, the more options we have, and often the faster we can match you. And the opposite is true. If you have lots of preferences, it's harder to find that person. And so it can take a little bit longer. Most of our families do fall pretty close to that 10-month average, but the wiggle room that we see back and forth has to do mainly with your own personal circumstances. So it's a little bit more challenging for us to match someone who only has 1 embryo versus someone who has 3 or 4. It's a little bit more challenging for us to match someone who doesn't speak English versus someone who does, things like that. But largely, it's intended family preferences that can control whether or not we can be a little bit quicker or a little bit slower.
Yeah. And the timeline on my end, so you have embryos ready to go, you have a preliminary match with a surrogate. My job is to be like the objective person looking at like medical safety, right? Because at the end of the day, not only do I want you to have a good success rate, But at the end of the day, I want to have a healthy surrogate and have you take home a healthy baby. And so that's my job. You're looking for all the things that you have for preferences. I am the like objective lens there. And so the first thing that we do when you have a match is we get all of the medical records. I get to read everything. You don't get to. And so you have to trust me that I go through it with a fine tooth comb, which we totally do. And that does take some time of doing that initial medical record review, which then I sign off on. Then we do a call with the surrogate to fill in any gaps, answer any questions. We read through psychological evaluations, all the things, sign off on it again. Then we do an in-person visit where we do blood work and infectious disease testing for everything under the sun and make sure that there's no undiagnosed thyroid issues or diabetes or prediabetes. Check the cavity of the uterus. While that's happening, you're finalizing kind of all of the things with your surrogacy agency in terms of the legal process and making sure that's all ready to go. And then we do one final sign off. And that process takes a couple of months, usually 2 to 3 months, depending on how quickly we get records and things like that. And then the last process is putting an embryo into the uterus. So one thing that I always tell people is that once you're matched, you feel like this is it, we're ready to go. There is another part there of just making sure that we're optimizing everything possible.
And one thing that I would add to that is during the surrogate screening process, which for us happens before you're matched with a surrogate, we're going to collect the surrogate's medical records for her previous pregnancies and births. We're going to work with a independent psychologist or social worker to get a psychological evaluation taken care of. And so hopefully we're going to have all of that paperwork ready for Dr. Rothenberg at the time you're matched with that surrogate. And our goal is that every surrogate that we match you with is going to be successful in this process. We're not at 100%, but 95% of the surrogates that we send to IVF clinics are approved at the medical record review stage.
And that's where it matters, where you're working with for a surrogacy agency, because the more that there's somebody that is sent that's not a good candidate, it takes longer. So that's a big deal.
Absolutely. One of the next questions I'm seeing is about success rates for a second transfer or a third transfer.
Great question.
A carrier.
Yeah, so I can answer that one. So the success rates with first, second, third transfer are actually exactly the same. Okay. So we always think about the uterus and the host as like the controller of success rates, but the embryo matters a lot. And so even if we have done genetic testing of embryos and we know that there's a normal number of chromosomes, which is something called PGTA, it's not perfect, right? And embryo has to be able to burrow in and become a pregnancy and then continue to grow and develop. So it's not 100% success rate with every transfer, but the success from 1, 2, 3 is the same.
One of the next questions I have is about vetting a surrogate and whether or not surrogates get to choose you as well. That depends on the agency you're working with. We are a two-way matching agency, which means that not only do we work with you to understand who you want to be matched with, we also work with the surrogate to understand who she wants to be matched with. And then we do what they call a profile exchange, where you get to see each other's profiles. And most of the time, both the surrogate and the family say yes. And as soon as we get our medical sign off, then we're going to schedule a match meeting. And over the last 2 years, we've had almost 450 match meetings, and we've had 2 that didn't result in both parties saying yes. There are times during this process where a match doesn't necessarily work out, but most of the time, the first profile is going to work out for you. And almost all the time, it's like 99.9% of the time, a match meeting is going to be successful and both parties are going to say yes.
Here, there's a few embryo questions I can answer quickly. There's not a minimum number of embryos to get started, but when you're going through the process of having a surrogacy agency, matching with a surrogate, my preference is to have at least 2 to 3 embryos. You don't have to have that, but it's always good to have backups and going through this whole process. Because like I said, not every embryo transfer results in a baby. To answer the other question, I generally like to have 2 to 3 embryos per child. And so there was a study that was done looking at 3 patients with 3 embryos with a normal number of chromosomes. And 95% of people had a baby. And that was not using gestational carriers. for that study. And so I think that 3 per kiddo is like a very safe place to be, but 1 embryo can be 1 baby.
Yeah, and what we see over the last several years is that if someone does 3 transfers or less, there's a 98% chance that they're going to be successful.
Love it.
A couple of questions about surrogate health insurance, and states do matter. Northwest Surrogacy Center only works in 15 states, and there's lots of reasons for that. One of them is availability of medical insurance. When we go through this process, we vet the surrogate's medical insurance, and it's a much longer conversation. Medical insurance is complicated in general, but medical insurance is part of this process. It does matter. And it's one of the reasons that you want to work with an agency who understands these things, because it is important that the surrogate has a policy, and a policy that is going to pay out for surrogacy.
The other thing to keep in mind too, which is in the vein of that, is the kind of changes in the last couple of years of laws regarding abortion and personhood and things like that. That's something to be aware of as well, of where the surrogate might be living, to keep in mind too, and just making sure that you have the availability to make the decisions that you would want to have the option to make.
Absolutely. And that's one of the other factors that we consider in working with surrogates. All of the surrogates that we work with are in states where a termination of pregnancy is available for families if they come to that hard decision. How many eggs do you typically get from an egg donor? That's a great question for you, not me.
Yeah, it totally depends. It depends on the clinic. There are some fertility clinics who they'll limit the number of eggs that you get from a cycle. At PNWF, we don't do that. We get somewhere in terms of eggs, which translates to embryos. We don't want to, there's a point where we don't want to push ovaries too hard and get too many eggs, because it can make the donor sick. And so we're trying to thread that needle of a good number of eggs, but not pushing too hard. And I would say it depends a little bit on the donor, but we select them specifically that they're good candidates. So somewhere between 15 to 25 eggs, 15 to 30 eggs. We have very high success rates with the number of blastocysts that you get. So typically it's somewhere between 5 to 10 embryos that could be transferred with 1 round. But that's also an important question to specifically ask each fertility clinic.
Yeah, and given success rates starting with 5 to 10 embryos, you're in a really good place and you're highly likely to be successful. Someone's asking a very specific question about they know someone who is applying to be a surrogate in our program, and can we still work with them? We'd love to talk to you. You can go to our website and let us know, and we'd be happy to talk about the details. It is a little bit more complicated when someone already knows a surrogate. There are some good sides and some bad sides to that, and we'd be happy to talk about that. The next one I see is, can I use my health insurance to cover embryo creation or IVF cycles for my surrogate? And I think that really depends. So I can cover the surrogate side of that. There are benefits programs out there that are reimbursement programs that help pay for some of those costs, and they can pay for part of your surrogacy and your egg donation as well. From an IVF perspective, maybe Dr. Rothenberg has a better vision for how all of that works.
Yeah, that's good. Sorry.
Okay. So what other questions do we have here?
Transfer of embryos. Yes, we do accept embryos from other places. We have a process where we would want to meet with you and review the clinic that you're at, look at kind of their techniques. There's lots of different ways to freeze and thaw embryos, and we want to make sure that your embryos would be in good hands with us first. And so that process can take some time. There's also certain embryos that we don't accept for transfer, but generally speaking, absolutely. But there is a little bit of lead time to go through that process, make sure that your embryos would be good candidates to be here, which for most of the clinics in Washington State, that's the case, and then to actually physically get them here.
And then I think the next question is a good one for you as well. So when does a surrogate go to the OBGYN after an embryo transfer?
Yeah, so I don't deliver babies anymore. So what we do, basically we take care of people during the first trimester. So the typical for anybody who's going through this process, whether this be here or at home. So sometimes people who are not local are getting their care with their OBGYN sooner, with us working with the OBGYN. But generally, we do pregnancy tests 10 days after the embryo transfer. We repeat it 2 days later, make sure that the level's rising. And then we do ultrasounds at 6.5 weeks and 8.5 weeks, make sure everything's growing and developing. And then they would graduate and go to their OBGYN. Most OBGYNs see people between 9 to 12 weeks. And so we want to make sure that we're bridging that.
And that's what we see with all the clinics that we work with. The next question I see is, can I go to the transfer and can I go to the OBGYN appointment? So why don't you take the first one and I'll take the second part of that.
Yeah, embryo transfer for sure. We would love for you to come to the embryo transfer if possible, of course.
And the same is true with OBGYN appointments, although it can be difficult to find a time where your OBGYN, your surrogate, and you can all meet at the same time. And so typically what we see are what you might call milestone appointments, the bigger appointments where families will go to those appointments. Sometimes if you have a very free schedule, you can make it to all those appointments, and most of our surrogates are open to that idea.
Mosaic embryos. That's a great question. From a medical standpoint, absolutely, that we transfer mosaic embryos. I think that it depends. It's a conversation to have with the agency and the surrogate. So, Michael, I think that's maybe a question for you to answer as well.
Yeah. And generally what will happen on our side is we'll connect the surrogate with the clinic so that they can ask questions. Often they'll talk to a genetic counselor about any risks that might be involved in that and just have the conversation. If you're open to it and the surrogate is open to it and the clinic's open to it, we're fine with that as well. From our perspective, it's mostly a medical question, and our policy is to let the doctors be the doctors and for us to be there to support.
Yeah. So if everybody's on board, absolutely.
What monitoring is done after the embryo transfer? How quickly will we know if the transfer worked?
Oh, I'll recap what I said, that the 10 days after, and this can vary a little bit clinic to clinic, but for PNWF, 10 days after the embryo transfers, I'm going to do a blood test to check the HCG level, the pregnancy hormone. And so we know pretty quickly 10 days after. And then that monitoring a couple of days later, ultrasound 6.5 weeks and 8.5 weeks.
And one of the next questions I see is, will my agency help support communication with the surrogate for appointments and any other milestones in the pregnancy? The short answer is yes, but also you're going to have a direct relationship with that surrogate. And that's something that we feel is really important. And there's lots of reasons for that, but the main one is trust. As you go through this process, trust is maybe the hardest part of a surrogacy. And you're going to develop that trust with your surrogate as you develop your relationship with her. And by working on that relationship, by working on the communication, what my experience tells me is you're going to find that your relationship, your trust with her is going to be much higher, and the communication is going to be pretty free flowing. As soon as you have a match meeting, you're going to have her contact information and she's going to have your contact information. But if there's anything that you need assistance with, part of our job is to help with logistics and communication. And we're definitely going to be there if you need us. All right. So the next one is, do you have any recommendations on how to learn more about surrogacy? Can I talk to another family? Yes. We both have robust websites and there's a lot of information there, but we also both offer consultations. And it's a great way to learn more about not only the program in general, but specifically how we work and the clinics that we like to work with, the attorneys we like to work with, how all of that works together. And so our website has a lot of information, but please come talk to us. You can sign up for a free consultation on our website. And I believe the same is true with Dr. Rothenberg.
Yeah. And the way that works for us. So we have a wonderful surrogacy guru. Her name is Molly Hayek. She's a nurse. She grew her family with surrogacy as well. And if reached out to our office and said, hey, we're interested in learning more about surrogacy, typically the first point is that she would reach out to you to chat even before you have an appointment with one of the physicians. So that's free of charge to just give you like a surrogacy 101. And so that's something that we think is really important. Again, because you're just like, I don't really know where to start. So she's an amazing resource. And so she's often the first point. We also have several Mandarin speaking options as well. So if you prefer to do a consultation in Mandarin, Chris would reach out to you and be able to talk you through the process in Mandarin as well. And that's for any type of fertility treatment, but specifically helpful for complexity of surrogacy.
So I'm seeing a question about financing. This is an expensive process, and there are lots of options for financing out there. One group that we often recommend is Resolve. They're a nonprofit that does a lot of work around fertility in general and surrogacy and egg donation. So they work on legislative aspects as well as partnering with funders and lenders, as well as grants. And going to Resolve's website is a great place to start and see what your options are.
Yeah. We also work with a company called Sunfish there's a few different companies that can help with fertility financing as well. But that's one in particular that we work with a lot.
All right. So then the next question I have is, what advice would you give us while you're just starting the process? And would there be anything that would disqualify us from using a surrogate to start a journey? So as far as starting, again, the conversation is probably the best way to start. You're going to learn a lot of information. As far as just being disqualified, I think that the only thing that I would mention for our program is that we do require a medical need for the family. And what that means for us is that there is either no one in the family that can carry a pregnancy, or there would be significant additional risk if someone carried the pregnancy. And we're happy to talk with you about that. Typically, if it's a more complex situation, we actually rely on the physicians to help us understand whether or not there is a medical need.
And there are also agencies who don't require a medical need as well. So on my side, there's no kind of disqualifying reason for using a surrogate. And that's the case for law in Washington state as well.
Absolutely. Can I meet my surrogate before the transfer? Absolutely. As I said earlier, you're going to have access to your surrogate's contact information. We can also help facilitate that. But many families come for the transfer. Many families will meet their surrogate in person at the match meeting. And if they can't do that, often it will happen sometime in between that match meeting and the transfer.
And I'll put a plug. Those of us at this meeting, so Michael and myself will be, including other members of our teams, will be at the Bellevue Club next Thursday from 5:30 to 7:30. If anybody wants to come in person and have more conversations.
Absolutely. And on both kind of our socials and our website, you can find more information and a sign-up sheet for that. You can just show up, but we'd prefer it if we knew you were coming, so we have enough food and everything. One of the next question is, have most surrogates been surrogates before? Does that help medically speaking? About 30% of our surrogates come back for a second or third surrogacy. And interestingly, and I don't know what your experience with this is for Dr. Rothenberger, but our experience is we actually see the same success rates for first-time surrogates and experienced surrogates. The reason people choose experienced surrogates is comfort. They've already gone through the process. They know what it's like. You likely haven't. And it's nice to have someone who has. I think one of the challenges is that it's only about 30% of our surrogates. And sometimes we have a family who really wants an experienced surrogate, and it can take us a little bit longer to match you if that's a requirement of yours.
And then for two children, I can speak to that. At PNWF, we are very dogmatic of following national guidelines of transferring one embryo at a time. Again, going back to what I feel like is my responsibility of doing this in the safest, most boring way possible, healthy surrogate and healthy baby at the end of the day. And the best way to do that is to transfer one embryo at a time and one baby at a time. That's not the case for all fertility clinics. Okay, but 97% of our IVF pregnancies at PNWF are one baby at a time. One embryo can split and become twins, but generally that would be the case as one baby per surrogate. But we definitely have people who do dual journeys and kind of have two surrogates and try to have two tiny humans close together. And then also I definitely have returning surrogates who carry a family carry a pregnancy for the same family for another child as well.
Yeah, and I love to see those situations. We have the same policies. So all the families we're working with are doing a single embryo transfer. We do work with families who are doing a parallel journey with two surrogates. I love it when a family and a surrogate come back for a second surrogacy. It's fun to watch that relationship develop. It's, for most people, a much easier process just because everyone knows what's going to happen and how it's going to work. And while there are no guarantees that your second surrogacy is going to be exactly the same as your first surrogacy, it's usually a smoother process.
Oh, yeah. And then check out both of our websites if you want to schedule any appointments of ways to, if you want somebody from our team to reach out to you, talk you through what surrogacy would look like, or to schedule an appointment with myself or one of my partners. And then do the same on the Northwest Surrogacy website as well, if you want to learn more.
Yeah, absolutely. I'd like to thank everyone for coming. And at least on our site, you can also email us at info@nwsurrogacycenter.com.
Yeah.
All right. Thank you.
Bye.
Bye.
Take care.